You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. Have you ever heard that the ketogenic diet could reverse kidney disease? If you listen to the conventional messages, the answer would be an obvious no. But I am happy to report that in my clinical experience, the outcomes I've seen with my patients tells a totally different story. In fact, I've shared some of my successes with patients reversing mild to moderate kidney disease on social media using images of decreasing microalbumin or creatinine levels with carb restriction. This is intriguing and exciting to learn, but I'm not sure if I'm living in a low carb bubble or are there others who are seeing patients reverse kidney disease with carb restriction. It is really possible if someone who is heading towards a life on dialysis to know that there may be another way to proceed. I wanted to explore this question in more detail by having a guest who had some experience using a ketogenic diet as a lifestyle option to help her clients improve their kidney function so that we can restore hope to anyone who hears today's episode. Today's guest is Teresa Rodriguez. Teresa is an Advanced Practice Registered Dietitian, an Integrative and Functional Nutrition certified practitioner, a specialist in renal nutrition, board certified in nutrition support clinician, and licensed dietitian nutritionist in Florida and Texas, and a certified LEAP therapist and ketogenic and low carb dietitian. Teresa has trained as a specialist in renal nutrition, nutrition support, mitochondrial health, the ketogenic approach, and identifying adverse food reactions with an emphasis on food sensitivities as part of an integrative and functional nutrition practice. Motivated to help her patients achieve their health-related goals, Teresa has found that a well-formulated, evidence-based keto nutrition protocol could be the key to helping her clients heal. Teresa is also the author of her new book, The Keto Solution for Kidney Disease, Reversing Metabolic Disorders with a Ketogenic Diet that will help her spread this healing message about keto and kidney disease. So, Teresa, it is my pleasure to welcome you to the Protecting Your Nest podcast.
Thank you, Dr. Hampton, for the invitation. I'm so happy to be with you. I'm so happy to share all this information with your audience.
Thank you. And my audience is excited. I'm excited. And this is probably one of the most important conversations I'll ever have on this podcast. And before we begin, I want to do a shout out to one of my Twitter followers. His handle is @GoLiveSports. And he is who suggested I have this topic about keto and kidney function. I also want to do a shout out to Cecile Seth. She is at Cecile Seth on Twitter and at the Metabolic Multiplier on Twitter, because she is the one who connected us after she saw the comments that at Go Live Sports made. So I really appreciate both of them for connecting us and getting us on this journey, because so many people have perceptions about keto and kidney function that we need to clarify. So let's get started. Many of my listeners have probably heard, that there's advanced practice clinicians, there's, who includes nurse practitioners and physician's assistants, but I'm not sure they've ever heard of an advanced practice registered dietitian, right? So as we begin our conversation, why don't you share with my audience, what your training allows you to do that distinguishes you from, other dietitians?
Well, my journey with the ketogenic low carb, you know, journey started like 7 years ago on May 15, 2015, when I started to getting blind. I work in a hospital,
Mm,
and I started with an allergic reaction in my eyes, And then my ophthalmologist was the one that made the connections about how people were coming to him, to his office, and with the same allergy reaction. And he was the one tell me, Teresa, I think your problem is mycotoxins, are mold. And after that, I was getting blind day by day by day. And then in November, I started like you did. I started to learn more about functional nutrition. And in November of 2015, I was like, I have a class with Beth Supek, who is a main dietitian from the Charlie Foundation. And she was the one explaining everything about ketogenic diet to me, the concept about ketogenic diet. And at that time, I was like, the only option that they offer at the hospital was disability. I was 48 years old, getting blind. And when I started to apply ketogenic myself, I was like, this is what it is. You know what I mean? This is what I need to clean my body in the ways to reverse what I have. And I was able to do that like in 6 weeks, applying the functional nutrition, what I learned at that time. And since then I started to learn. At that time was when I took the board as a advanced level practice dietitian. I was one of the first 20 dietitians in the world that passed that board. And that change in my life gave me the opportunity to even pass that board, and then later on, learn more about how I can use it, how I can use a low carb ketogenic approach to reverse all the diseases that I see in my patients until then.
I've had other nutrition professionals on the podcast, and they struggle with continuing to practice um, as a dietitian because most dietitians don't recommend keto. So, has that been a barrier at all for you?
It has been really hard because other colleagues didn't accept what I was, what my story, and they don't accept how I can use it even at the hospital that I work there. And but it didn't matter. I moved forward, and I was part of the functional nutrition practice at the hospital. And later on, I have to resign to the hospital
Mm.
because obviously it was not easy to be accepted by other professionals, especially my managers and other dietitians. Mhm.
That's what I figured, and it's so sad that you have something that's helping yourself and the people you are trying to help, and yet we can't see the forest for the trees because we're kinda locked into this, paradigm where we have to follow practices that don't necessarily serve us, but that may benefit us. So I it takes a lot of courage, and I really am so happy that you had the courage to figure out that this was a better path for you. So applause to you. I bow down to you right now as we kind of celebrate this information. So I do want to touch on this different approach. You kind of have a different approach as you coach patients with this, hopefully, safe and effective nutritional approach. You have protocols for metabolic disease, autoimmune disease, critical care, neurological disease, and environmental toxins. By the way, me and my wife, we did have a massage and we did get in a sauna just a couple of days before this recording. So we do understand the value of removing toxins from our body. So as a as a clinician who deals with functional medicine and you have clients in front of you, you're teaching this keto approach. But if I were to walk in your office as a new client, share a little bit about that experience for a person in terms of what they would expect to experience from you. Share what's different about your approach that I think people need to hear.
Well, it's like each protocol is different for each patient. Obviously, I believe on personalized nutrition. I believe that each we are n equals one. This means that what is good for me is probably not good for you, right? And that's the reason that even ketogenic diet, when we have these meetings about, and we talk about ketogenic diet, we talk about how it's so different for epilepsy, for kidney disease, for even in the world of kidney disease, it's different. All depend of the stage that the patient is. If it's this, outpatient setting, inpatient setting, acute care, hemodialysis, PD. If it's a patient polycystic kidney disease, even polycystic kidney disease and CKD is a completely different ketogenic diet. It is like it's a different, it's personalized, it's based on your I use in my clinical practice, I use genetic testing. I use genetic testing because I believe, and that is what I wrote in chapter 2 in my book, I believe that the future of medicine is going to start with the genetic testing
Yeah.
because it's the blueprint of our body. It's
Yeah.
no way that we can continue to make decisions on patient care if we don't do genetics. It's no
Right.
way.
No way.
In addition, another additional tool, I use obviously conventional labs, but I love your presentation in Low Carb USA because when you discuss about labs, you discuss like, okay, this is like what conventional said about this labs, but this is what we see as a functional practitioners, and that is exactly what we see. When the patients comes to me, I say, show me your labs. It doesn't matter that the doctors say they're normal. Just show me everything that you have, because we can cache a lot of things. One thing that I did as a preceptor at the hospital that I work is I teach about labs. I teach how you can interpret labs, how you can find a lot of information, about the current status of the patient. And labs is so important. It's a key clinical puzzle, piece of the puzzle. And then I use to organic acid testing, where organic acid testing is telling me right now what is happening right now,
Mm-hmm.
what factors are causing damage to the mitochondria, what is causing damage to the cell, if this patient is exposed to mycotoxins, candida overgrowth, all these factors that we never hear about it. Even one of the fails of conventional medicine is to that even that we hear since 2015 about oxalates. Nobody care about oxalates. You know what I mean? And this is a major issue, major issue right now. Oxalate is it could be the reason why people has autoimmune diseases. There already a correlation, at least for 18 autoimmune diseases with oxalates. And that by itself can cause damage to the mitochondria, can cause, behavior changes. It can cause a lot of issues. And as soon as you address that, they're fine.
I
You
know.
know, it
Yeah.
is so crazy.
Yeah. I really think it's important that people who are hearing this episode understand the value of not feeling stuck. So a lot of times people are in conventional practices and the doctors kind of throw their hands up and say, I just, we've done all the tests and nothing's wrong. Well, the reality is you have not done all the tests. And I don't blame those doctors because they weren't trained to do
Mhm.
things that are beyond their scope. So if you're listening to this and you're thinking, I'm stuck, understand there may be some functional medicine clinicians who have training to look for things uh, that Teresa has just shared, things that you haven't even heard of. As I have studied nutrition and functional medicine, it's like going to medical school all over again because there's things that we're talking about that we never talked about in my training. So I feel honored and privileged to have made that choice. And it also broadened my perspective about what you said. You got to treat the individual. You have to, I mean, I literally just took a genetics course one semester ago, and I learned all of the things that our genetics tell us. And I agree with you that one day, in a tester starting to come around, we have some already. We'll be able to do some tests so we can individualize the care. And there's no test that'll be perfect, but it'll at least guide us down a path that's more likely to lead to the outcomes we're looking for. So really, if you're stuck, there are answers, just like hearing this podcast and learning, "Oh, I can reverse kidney disease." So, let's talk a little bit about your book because a lot of people listening to this episode have not heard anybody in conventional medicine say it's possible to reverse any level of kidney disease. That's how I was trained, and I did not believe that was possible until I saw what happened in my own clinic. Now, having said that, if I were on, Amazon or, your book's going to be available soon. If I was able to order your book and put it in front of me, what would I expect to get out of it? Who was that book written for, and what can they walk away with if they get it?
First, everyone here that you cannot reverse kidney disease, and I see every day in my life that you can reverse kidney disease. This is like so ridiculous. Like even I see patients when my ketogenic, I call my approach pH balanced ketogenic diet because, and it's a lifestyle. It's a lifestyle. It's not like about give it to you like a less of eat this or eat that. It's like the whole approach. And then I see like patients improving like in weeks. In weeks, like even GFR number increasing, like the balance between acid base balance in the kidneys. And that is the key to prevent further kidney damage. It's like I see reversing kidney disease. Even I'm so blessed because when I went to the Metabolic Health Summit conference in 2020, it was in California. When I went there, I hear for the first time that we can use ketogenic diet for polycystic kidney disease. And at that time, I was working as a kidney dietitian. I would say like I have more than has been a dietitian for 28 years, but I believe I have like about 26 years, working as a kidney dietitian. And then when I hear that, I was already working with ketogenic diet. The only options, if you don't know, is a genetic disease, and the only option at that time was dialysis and transplant. Right, the only options that we have for PKD. And since then, I start with my first patient like a month after that I hear that, and that particular patient, his goal, I always ask my patient, which one is your goal?
Mhm.
What is your goal if I try to work with you? And he said to me, I want to be 50 years old. I want to celebrate my 50 years old because my dad died of polycystic kidney disease before he
Mm.
was 50, and because he got a transplant too. And I was like, okay, it's always a hope. We're going to work together. And we just did that almost 8 years ago. We reached our goal. And that was almost like 2 years ago. And, it's always a hope. And obviously, if you do personalized, one key factor is to understand. I like to provide educations to my patients. Like when they comes to me, my assessment could be like an hour and a half, or almost 2 hours. And after that, they go to my private Facebook group where I teach them almost every week, at least twice a month. I provide a class to them and I teach about different topics. And they learn about everything, the whole approach about ketogenic diet. But you can, I see this all the time, every day. You can reverse kidney disease. And that is the reason I wrote the book, because we have to spread the word that we can do it. If the patient is willing to do it, I am willing to teach them how to do it.
Yeah, and I am, again, so happy that we're having this conversation because I think it's one of the most scariest things. Like when I talk to patients, they talk about amputations, they talk
Uh-huh.
about blindness, and they talk about dialysis. And those are like the 3 scariest things. For some reason, they don't think about the heart attack or the stroke as much, but, the point of it is, like, giving people hope. And and I just wanna talk a little bit about why there's so much confusion. So, you know, in 20 there was a meta-analysis done in 2021 of randomized controlled trials looking at stage 1 through 3 kidney disease that did show that restricting protein, right, intake less than 0.8 grams a day did seem to protect the kidneys, right? And but the thing is, when you look at that study, it was really low quality. It was a small study, and it just did not meet the standard, that I would, suggest we should meet. Another thing I wanna mention before I suggest another study is I think it's really important we are very cautious, and I've said this on previous podcasts. Observational studies we have to be cautious about because there are studies where we're sending surveys to people's homes and things like that. So when you're looking at what's in the headline, the first thing you ask yourself, was this study a observational study or a randomized controlled trial? That's the first question. The second question you ask, if they're suggesting that too much protein or a low carb diet is harmful, the first thing you gotta do is ask, well, what is it a low carb study? And many of the studies I've looked at in the past that were food frequency questionnaires, and you look at the carbohydrate intake, they may be taking in as much as 200 or 150 carbs a day, which
Yes,
is not low carb. So
exactly.
so in the low carb community, we don't consider those studies that we even pay attention to because they're not really low carb. So now if you wanna contrast that with a standard American diet, that's fine. Now, one study I wanted to mention that I wanna celebrate, in fact, a previous guest on the podcast was Dr. David Unwin in the UK, and, Dr. David Unwin is known for his infographics. So for those who are watching on YouTube, here's kind of a black and white. They're usually in color, so you'll get a better example. I would just search Dr. David Unwin in the UK, and his study that I pulled because I knew I was talking to you, Teresa, today. It said renal function in patients following a low carb diet for type 2 diabetics, a review of the literature and analysis of routine clinical data from a primary care doc like myself for over 7 years. And by the way, Dr. David Unwin and his wife, Jen Unwin, who are the first authors, are just amazing, salt of the earth people. They're just amazing. It also included Dominic Crocombe, Christine DeLone, Nicola Guess and Christopher Wong. I want to acknowledge those other people, but let's talk about real briefly what it says. So, the purpose of the review, people with type 2 diabetes who follow a low carb diet may increase their dietary protein intake. Dietary protein intake can modulate renal function, so there is debate about its role in renal disease. There is concern that higher protein intakes may promote renal damage and that low carb diets themselves may impact on cardiovascular risk, and they did a review. Basically, what they found is that chronic kidney disease is a well recognized microvascular complication of type 2 diabetes caused in part by chronically increased glomerular pressure, hyperfiltration, increased blood pressure, and advanced glycation in products. Hyperglycemia may be seen as central to all these factors. A low carb diet is an effective first step in its correction, as we demonstrate in our real world cohort. Now, the summary was we found evidence that the low carb diets for people with type 2 diabetes may improve many renal and cardiovascular risk factors. In our own low carb diet cohort of 143 patients with normal renal function or only mild chronic kidney disease over an average of 30 months, the serum creatinine improved by a significant mean of 4.7 nanomoles per liter. What remains to be shown is the effect of the approach on people with type 2 diabetes and moderate to severe But what this study shows by Dr. Unwin, his wife, and his team is that if you just based on this study alone, there's others, it's clear that people, I think it was about 67% of the people who followed this dietary approach had improvement. So it didn't harm you at all, first of all. And number two, they saw improvement. So I just think that I wanted to bring that up because I think that, again, there's going to be a lot of pushback. And I'll share this study in the show notes. But, as you've done your research, you've had anecdotal experience because you're like me. I just see people's numbers getting better. Now, what else did you find out there to help justify this position that kidney function improves?
I always said, based on my experience, is don't blame on the protein what the carbohydrates are doing.
Yeah.
And that's the I always say that that's my rest, of that, because when this, as you said, most of this study has been done with the high carb diet. It doesn't matter that they say the low carb diet; they're not. They're over 200 grams of carbs a day. Another problem that I see in my practice is even we still using, it doesn't matter that cystatin C is a protein that is more reliable than creatinine.
Mhm.
Creatinine can change based on your protein intake and in your muscle mass. However, more and more studies show that cystatin C, that is another protein, will not change with the protein intake, and also is more reliable than creatinine. And it was really interesting because the other day I have Dr. Callanter, who has been published like over 400 articles about kidney disease. I have him in Facebook, and he put in a study in ICU setting where they monitor creatinine level and they monitor cystatin C. And I work in critical care for 22 years, and we always base on dialysis needs based on creatinine level is high. We need dialysis. However, this particular study shows that, well, creatinine was up, still up. Cystatin C was low. Is no need for dialysis.
Mm.
It's like the question here is: are we using the right marker still? Why we still using creatinine to make decisions about kidney disease when it has been very well established that it's not a reliable marker for kidney disease? You can have high creatinine, but it's still, if you are making urine, if your protein is like, if you reverse proteinuria, all of these factors, we have to see it together in when we have to make decisions about kidney disease. And this is a problem. Conventional medicine is still using, creatinine, and that's the reason when the patients comes to me, they say my creatinine is this or my B1 is this. I'm like, I don't look at them. I mostly look at, are you making urine? How much urine you're making? How is your skin hydration? I think we have to start doing, I don't know, I'm an old dietitian. When I was younger, I always remember when the doctor comes to my grandparents' house and look at them, at their eyes, their skin, to make the decisions. And physical assessment is so important
Mhm.
at the time to make decisions about a patient. And it gave me a lot of information about the nutritional status of the patient at that time, every time that I see them. But again, I hope that maybe in few years we're not going to use creatinine anymore as a marker for kidney disease, and we can use more cystatin C. Another things that you mentioned there in that particular study is about phosphate. No, it's about cardiovascular disease.
Mhm.
That is another thing that I'm against of the conventional medicine in term is don't blame in the cholesterol what the phosphate additive are doing to the patients.
Mm.
It's like I will, like the other day, Dr. Callanter put another study say that LDL is not, it's not a marker really of cardiovascular disease by itself. I'm like, yeah, don't blame it on
Right.
that when the phosphate additives are the ones that are doing the damage. I did a study with one of my interns in 2011. And at that time was interesting because I was working with in the dialysis unit, and then we saw like a lot of almost everyone, all of our patients have high phosphorus level, and we were like, we have to go out and find out what is these people are buying that are making them to have high phosphorus level. And we did that. And then interesting is when you buy natural sources of a product, let's say that is a meat product, the absorption of phosphorus is 60%. When
Mm-hmm.
you eat like vegetables, the absorption is 40%.
Mm.
However, when you buy a product that has in the labels phosphate additive, I mean with phosphate additive, like the calcium phosphate, all of this. If you see labels in the ingredients section that they say phosphate, decalcium, calcium phosphate, all of this will identify that has phosphate additive. And when that happens, when you eat, like we found that one of the most famous donuts in the US have three kind of different phosphate additive, two with the donuts and one with the glaze. And the problem with that is the absorption is 100%.
Mm.
And one of the role of the kidney is to keep the balance between calcium and phosphorus. And when you eat like high phosphorus levels, what is happening? The body is like, I don't know what I need, it's going to start to increase the phosphorus level and then decrease the calcium. The body start to take the calcium, steal the calcium from everywhere that you have the calcium, and then it's going to be everywhere in your body, and it's causing the calcifications.
Mm.
And that is what is causing more damage. Recent study shows that now, we see studies that shows endothelial damage, cell damage, apoptosis, like damage to the kidneys, like to the bones, obviously, and left ventricular hypertrophy.
Mm.
Even all these cardiovascular things, it could be secondary to the phosphate additive. And
Mm.
and it's interesting because I'm going to share this with the audience, but I see all kind of patients, and then even patient with erectile dysfunction, when you see them, it's because they have high phosphorus level. you
Mm.
know like when the patients comes to me, they say, I have, like, I'm having kidney disease. My doctor say I'm having kidney disease. I'm like, okay. I check everything. So one of the things that I check on them is the supplements. How many trash supplements they're taking, and they're taking like five or five of 10, maybe five or six. They have phosphate additive. Plus,
Mm.
they're drinking sodas and things that they have phosphate additive. If we blame on cholesterol, or we have to blame the phosphate additive. You know what I mean? It's like,
Well,
this is crazy. It
that,
is.
but again, doctors are not getting the training. The clinicians are not getting the training. So, to think even about that, you have to really think outside the box to even think about that. And again, it was the functional medicine training that opened up this opportunity of possibilities beyond what I was, because we kind of get locked in a box. We get locked
Mhm.
in to how we think, and we just don't think there's other possibilities. And if we were to change our health system, whether it's the conventional or others, the first thing we should do is say, let's train people to be thinkers. Let's train people to be problem solvers. Let's train people
Mhm.
to always question conventional wisdom. And thankfully, when I got into my nutritional master's program, I had a foundation that naturally led to me questioning everything. So I kind of come into the conversation that way. If I had not had that foundation, I'm not sure I would have done that. But I do appreciate that. I do appreciate also you mentioned, when you talked about the research and
We
is it
always have to go to the root cause. What is
right?
happening? What
Yeah.
is happening? I want to share this story about a particular patient that she have a 3 years old. She's a 3 years old. Moms and dad call me because the cyst, she have a polycystic kidney disease. She born with polycystic kidney disease. The cysts start to grow, and they were like the okay. And then I look at them. It doesn't matter that my consultation is a virtual consultation because I have patients everywhere. When I look at them, I look at the scheme. I ask them to open their mouth for
Mm.
me. And then when I ask, that particular patient with the parents' approval to open her mouth for me, she have amalgams at three
Mm.
years old.
Really? At 2? Okay.
3 years old. And I was
Explain
like, okay,
explain what that is. Some people don't even know what that is. Explain what that is when you say that.
the amalgams is a
Yeah,
silver filler. Silver
yes.
fillers when you have cavities, okay?
Exactly. I just wanna make
And
sure
then
everybody
I asked the parents, do you guys realize that start to happen, when the cysts start to grow after that you put the amalgams in her mouth?
that's right.
But that was not the root cause. That was not the root cause. When I did organic acid testing, she was high on oxalates. And
Mhm.
oxalate love the minerals, love mercury. And what happens with that, when the patient has problem with oxalates, based on my clinical experience, the first things that I ask parents is any mold issue in your house.
Mhm.
Yes. And that was the issue. The
Mm.
root cause in that case was mold mycotoxins and in their house and mycotoxins, because my personal experience, I learned a lot about this.
Mhm.
Mycotoxin change the microbiome in the way that we block the absorption of complex B vitamins that you need for detoxification properly. Will make you intolerant to gluten and will make you to be more susceptible for cavities.
Mm.
This means, and in order to control this particular patient, the growth of her cyst, I have to detox properly her. And then also, I have to teach the parents how to do that properly. One thing that I believe is we have simple ways to detox. Okay,
Mm.
like Epsom salt bath if it's oxalate issue. We have to be sure that that particular patient, when I did the genetics, she was intolerant to lactose, and then she have deficiency of B6, which
Mhm.
are two key factors that increase the risk for oxalates too.
Mm.
And why? Because people that are intolerant to lactose will not drink milk, right? They're
Mhm.
like, and they need the calcium or magnesium to bind the oxalates. And then she was not taking that. And I suggest to you not do it if you have, if by genetics you cannot do it. You can do calcium or magnesium citrates with the meals. That's another thing. If you have oxalates issue, you can take it with your meals because you're using with as a binder, not as a supplement.
Mm.
And another thing is like Epsom salt bath because will take help to take the oxalates out of your body too. And
Mm.
complex B vitamins, especially B6 supplementation. That's the things. You have to go to the root cause of what is causing the kidney damage. You
Mhm.
have to go to the root cause of why is making the cysts of the polycystic kidney disease growing. And I'm sharing that. I shared that in my book because I want the parents to learn that. Um, one thing that help us to understand more about oxalates is the studies has been done with patient with autism.
Mm.
Like they found out all this relation with other diseases, and again, you can resolve oxalates issue if you do the right thing.
Mhm.
Yeah.
I just think I was trying to convince, those who were listening to consider this idea of considering another clinician to get a kind of a second opinion, a functional medicine doctor. Now, and I say that now because what you just shared with us is how functional medicine doctors think, right? You are like, what's the root cause? Even when you suspected the feeling was the issue, you still kept asking the question, "What's the root cause?" And that's what allowed you to discover something deeper. So I really think that's important, even as a patient, that you're never satisfied until you get to the root cause. So if you run into walls or doesn't seem to be clear, you do your own research, you keep searching, you support your clinician to keep doing research, and you keep digging deeper, keep peeling the onion, because there's always a reason for everything. So I think
Yes.
that's a great example of why we want to have clinicians trained to think a little differently. One of the things that I think some of the people who are gonna hear this episode are gonna worry about as we think, about the kidney is, "Man, if I do that keto thing, that's gonna be, high in protein." The first thing I say to people, the most important thing about, low carb is low carb, first of all. So a lot of people on a low carb diet, are and even keto, they're not really necessarily high protein, but I just wanna say that first. But the bottom line is, it is a great we do measure microalbumin, which is microscopic protein, and even if particularly if I see a person with lower extremities that are swollen, because when you lose protein, you sometimes get swelling. But I just want you to speak a little bit about this protein concern, and based on what you've seen in practice and what you've read, how concerned should people be about protein
In
if
t-
they are trying to do keto for
okay.
kidney function?
In terms of protein, ketogenic by definition is moderate protein. Okay.
Exactly.
And then what I do is I adjust this based on the metabolic acidosis status of the patient.
Mhm,
One of the things that we're failing in conventional medicine is, well, at least the National Kidney Foundation finally last year changed the guidelines, and then they define metabolic acidosis of carbon dioxide less than 24. But I believe, and that is what I wrote in my book, that if we really want to prevent that, we need to changes from stage one, to be less than 24 is a risk factor. And what I did was I explained in my book, it's not you adjusted based on the protein needs or the body needs. One of the things I consider, I don't know if because I was a critical care dietitian for 22 years, I consider that to keep your lean body mass is the goal in your body. Okay, it's like you need to keep your lean body mass. And if that's another mistake that people are doing, like a lot of fasting for a long period of time, when they are not prepared to do that, they're losing lean body mass. And that is the reason that I teach my patient how to prevent to lose that lean body mass. There are some scale like easy, like I recommend one in my article in my website that will monitor your muscle mass, will monitor all this everything that you need as a baseline to monitor every day in your life to have the idea of what is happening in your body. Okay.
mhm,
One important thing I want you to understand too is obese people like Aspen, American Society of Parenteral Enteral Nutrition, changed the guidelines in, I would say, 2012, 2019, because they realized that even obese patients, they're so low in lean body mass. Okay.
mhm,
And you need the right amount of protein to keep your lean body mass. And that is why I recommend in my book. It's like we can adjust this based, and again, I do personalized nutrition. I tell my patients what they have to do, how much protein they have to do, based even when we have a patient with chronic kidney disease in acute care injury or in ICU setting. we treat the patient like an acute kidney injury. We increase the protein because they're so catabolic. It's really, really important to adjust the protein based on the catabolic state of the patient. Yeah,
Mm-hmm.
it's very personalized, very individualized, and I recommend you usually at least again one between at least one or if you know how much lean body mass is in your body, just 1 grams per lean body mass.
Mm-hmm.
Yeah,
Fair. And I would say out loud that a couple of things I would do if I was a person listening, learning about this information, and what do you do with that information as we continue this conversation. Number one, I'm going to share Dr. Unwin's study so at least you have a study you can present to your clinician who can, have that study in front of them and say, okay, I see that there's some evidence that, a low carb diet, keto can improve kidney function and it's not necessarily a problem. Number two, I think what I'm hearing from you is it does take a certain level of expertise. It's clear that the mild to moderate kidney disease is, based on these studies that we've quoted, are clearly going to be helpful. There's a point where you need experts. If you become, more severe, you need people that know what they're doing. They understand how to balance electrolytes. They know what to look for. And you want to have someone with some level of expertise who, if you're going to do a diet like this in that setting, you just need to do it with the guidance of people who understand it. Some of those people can be found, with the society. I know we're both members of the Society of Metabolic Health Practitioners. You may find clinicians when you search for a clinician in your area that has expertise. You may find functional medicine doctors who do, but I think it requires, having someone to kind of guide you and support you. The key is to find somebody that's willing to hear that the science may be a little different than what they've seen in the past or what they've heard. And are you willing to walk with me in a safe fashion towards healing? But what I can say with certainty, based on my anecdotal experience, when I have people who are, mild to moderate and they make their dietary change, I see miracles happen. And I think that's really important. Let me ask you this. If you think about stages, right? So you have, stages of kidney dysfunction. You have stage 1, 2,
yeah.
3A, 3B, stage 4, stage 5. Is there a point? And I think stage 1, 2, 3A are probably a no-brainer. You can do that and the thing about all of this stuff, you can monitor. So no matter what you do, you can monitor how you're doing. So if you find yourself moving in a direction that's not favorable, you can always go in a different path. When you're faced with clients in front of you who are at these different stages, do you have a different approach other than monitoring more aggressively when they're stage 3B, stage 4, stage 5? Obviously, when you get further down that road, you have to be more careful. How do you deal with that?
Okay, first, as I mentioned before, okay, there are like 5 stages of kidney disease, but for me, that's another controversial thing about GFR. Is GFR really 100% reliable, or we have to look more markers?
Right.
What I love to do, and that is what I explain in my book, I think one of the role of the kidney is keep the balance between, acid-base balance. And I think for me, it's more important to monitor carbon dioxide level and the pH in urine. And that is a really marker that will give me the idea if I have the adjustment that I have to do. More than look at the protein, even you, again, here are the factor number one, risk factor number one is the carbohydrate, the SAT diet, right? Is
Hmm.
going to every time that you eat trash, like really trash foods, you are sending information to your body, okay? And that is will increase, is will put you in one of the role of the kidneys and the lungs is just to keep the acid base balance, right? And every time that we eat trash foods were making the kidneys to work more than they were supposed to. And that's the reason that I teach my patient how to make, or I create the pH balanced ketogenic diet, because I want them to eat in a way that will not make the kidneys to work hard, you know, and will prevent or preserve the further kidney damage, even to reverse the kidney damage. And simple ways just to monitor your pH and ketones in the morning, find out how are the levels, and then based on that, make a decision. Okay, what I have to do. Do I have to drink something to keep my balance, pH in balance again? And then I create again a system that like I divide the foods in like more base or alkaline versus more acidic foods. And then I recommend 20 to 30% of more the acidic, and then 70 to 80% more the alkaline foods. And then that way you will keep always the balance in your pH, and that will prevent you to have further kidney damage. And let me tell you, you can do even that with like protein in your diet. You know, even that's another mistake that they say if I have kidney disease, I have to go a lot of plant based, like 100% plant based. It's not based on my experience, because you need meats to provide the carnitine that you need to provide. Carnitine is so important. That's another things. Oh my god, if I go there, we'll never finish here, because that's the things. We're really one of the role of the kidney is to make carnitine. Okay, and we need carnitine and B2 riboflavin, and and B6 and B12 to. It's like if you have a train, like when you have a train, you need that to put the fatty acid in the right, you know, place in the train, right? You need that. And carnitine, there's so many people deficient of carnitine. And is it really cholesterol the problem, or is because we have the lack of carnitine in our body?
Mm,
Because we have kidney disease, you know what I mean? That's
right.
another thing. I found like most of my patients, they're deficient of carnitine. And as soon as I supplement them on carnitine, they're putting the fatty acid in the right place. They have energy. There is no more damage to mitochondria, and then they can reverse all of these things. It's really really important to monitor carnitine. And I like to do organic acid testing. It's more reliable, even for B12, to use organic acid testing than conventional labs. Yeah.
Yeah, carnitine. I think I talked about carnitine during my mitochondrial lecture. I mean, it's critically
Yeah.
important to understand that. Again, these are things that we're not taught to focus on. Therefore, most doctors won't even think about that. So I completely agree with you. And
One
uh,
important thing is we have to realize that already diseases like autism,
mhm.
like polycystic kidney disease, like most of these diseases is already a damage in the mitochondria.
Mm.
And you
I,
have to understand what is happening there in order to supplement and reverse the damage, and then the patient is going to be fine, after that.
yeah,
Yeah.
it's these deficiencies are again not even in a conventional training. There may be some discussion about even the mitochondria, but it's not at the level of what you're saying. It's mostly about what types of genetic disorders cause mitochondrial dysfunction, and they focus on that. They never really talk about how do we make these things that are leading to mitochondrial dysfunction, not necessarily genetic things, but just in general. How do we heal the mitochondria so it'll function better? That kind of conversation doesn't occur. So I think it's nice to know that you can heal the mitochondria, and it's also nice to know that as you described that junk food, right? If we stay away from that, we stay away from processed food, we stay away from
Yeah.
refined
Hmm.
grains, stay away from sugar, and we therefore don't have oxidative damage. We don't have inflammation
Exactly.
and all these free radicals occurring. So I think it's important that we learn to not add the things that harm us, and we learn to remove the things that harm us. So I think that all of those talking points are wonderful. Another thing that's kind of kidney related, but not necessarily what we're talking about is kidney stones. And I know a lot of people who do keto, they worry about um am I going to get kidney stones now? You hear about things like that. And, obviously, uric acid stones are not that common, but people worry about that. They worry about gout. But have you had clients come to you asking questions about, this diet and them being at risk for kidney stones and things like that?
Again, it's the same story. For It's mostly genetics. If I pick like 100 patients, when I have been doing this for 20 years, and then most is a genetic factor there. Another problem is hydration.
Mhm.
Okay, you need proper hydration to control, because your body is dry, it's going to change the mechanism. Instead of glucose, it's going to start to use fructose, and that's the reason I increase the triglyceride level, and then that's the reason that will increase uric acid. Another thing, key factor, and that is the reason that I create the pH balance ketogenic diet, is if your pH is imbalanced in your urine, is no way that you will increase the uric acid risk.
Mhm.
You know, that's the key. No way that you increase. You keep the acid low, and then you will control that factor. And again, it's simple, just to monitor your ketones and monitor your pH imbalance, pH in your urine in the morning. What I expect when they do that is, goal is to at least have in 6.5.
Mhm.
Ideal is between 7 to 7.5. A study shows if we have a lot of toxins in our body, study shows that if you keep the pH in urine in 7.5, you're going to be able to get all the toxins out of cellular level. That's
Mhm.
really, really important. And believe me, this is what I normally do. We do at the hospital and ICU care setting. What we do is, when the patients start with the kidney problems, what the first things that they do is flush the kidney, what we call always flush the kidneys with bicarb, and that's the reason I create this system where you can keep the pH in balance and take the toxins out and prevent all these kind of kidney stones that you could have, like calcium phosphate kidney stones, mostly because the phosphate additive.
Right.
Oxalate is mostly mycotoxins, more than the oxalates intake is, like, again, urine. The thing is, when your urine is low, like less than 6.5, plus that you're eating things with phosphate additive, what is happening is you're making microcrystals, nanocrystals sometimes, and that is the reason that you have all these issues like arthritis, you have kidney stones, you have cardiovascular disease. So all these issues are because your pH is not in balance in urine, you know. And that is what we do with organic acid testing. The urine gave us so much information about how is your body working.
Yeah.
Even GI, how is your microbiome? Is a good bacteria winning or no winning? It gave us so much information about how is your body working. It's
Mhm.
really, really important that if you keep your pH in urine within normal level, again, greater than 6.5, the ideal is between 7 to 7.5. And you will not have any kidney stone issues at all.
Yeah. But this is the thing. I mean, everything you're sharing is very compelling. And again, there was no conversation in my training before I did functional medicine. I never knew there was, you know, organic acid testing.
Oh
It
yeah.
did this, right? So if you're listening to this episode, you have to then say, huh, there's all kinds of things that are happening in maybe my conventional office that doesn't even address these issues. So if you're struggling, again, you just need to be able to see the world through a different lens. It's no guarantee that'll answer every question, but it's a good chance you'll find answers you haven't found. And the good
Mm-hmm.
thing about this approach is mostly lifestyle changes that fix everything. There's some supplements and things you can do as well, but man, it's a lot of lifestyle things that'll help. And I wanted to comment. I just made a video uh, that that's really, and it's entitled "Low Carb Starts with a Kiss," right? And I like acronyms, so KISS is keep it safe and simple. And in that video, I was messaging, that for most people to achieve metabolic health, it's really just about reducing carbs. That's kind of like the big crowd approach. And then I've learned that there are some conditions that you really need to be in ketosis. It may
Mm-hmm.
be
Yeah.
neurological things, right? So when it comes to what we're talking about, kidney function, have you seen that it's important to actually be in ketosis to receive benefits, or is it just more important to just kind of be in a low carb state? What do you think? What's been your experience?
There's yeah, there's some conditions that is no doubt that you have to be in ketosis. It's
Mm,
like one of the example, because we're talking about kidney disease. I want to be sure that every person with that have polycystic kidney disease, is they found out that it's a metabolic disease, and it's no way. If you want to control how the cysts are growing, you have to turn the switch to ketones instead of glucose. If
mhm,
you want to stop and control the progression of the kidney or the cyst to grow, because they found out that if you do that, if you switch to ketones instead of glucose, the cyst do stop the progression of the
mhm,
disease. That's a big finding, and that's the reason ketogenic work. However, let me tell you about that, and that is a good thing that we meet at least once a month with Cecile and Metabolic Multipliers, a group of dietitians. We meet at least once a month, and we discuss all these issues, and we're trying to create guidelines. And soon, I think we're gonna Cecile is gonna publish that guidelines about what is low carb, what is ketogenic.
mm,
And the thing is, even virtual health. Let's say that the patient has diabetes.
mm,
Based on the study that has been done, for them, nutrition ketosis is 0.1 or more, just for me, I see that I see my patient with diabetes. I don't have to go to zero point 0.5 to see the changes, right? However, in PKD, probably that has to be close to zero point 0.5 to 2. Why no more than 2? Because ketones are acid too, and we don't want to make that, if you have metabolic acidosis, we don't want that problem to get worse, right? And this means that we have to have that under control,
mhm,
even in different, however, because I treat all the other conditions like epilepsy, we see that in epilepsy, like around zero point 0.5 to 3, they're fine. You know what I mean? We even, based on the disease, it's a different protocol for how to treat and use ketogenic diet. Yes,
mhm.
it's a different markers for them, different
But it
markers.
sounds like for the average person with some mild kidney dysfunction trying to reverse it, it doesn't have to be as, you don't have to necessarily have to measure ketones if you're that
No, you can
right.
see it in other, like, when you, that's interesting things, how even when you don't monitor ketones, you can feel it, right? That you're in
Yeah,
ketosis. Oh
yeah,
my gosh. I
yeah, it's
was
like
like, when I start doing that for the first time, I told you that I have plans to take the advanced lower practice board. And I was like, why nobody, I was I was like, why nobody told me about this before? Because I was
uh,
so sharp, like for to
yeah,
take the test. You know what I mean? Like your brain is working like a
yeah,
100%.
like you just drunk coffee or something. It's, you get kinda wired, and you're right, your focus is there. you're
Mm-hmm.
just a more efficient. It's like a more efficient fuel source.
Oh
That's all.
yes, it's
It's
no doubt. I
it's
feel like my book is not only I put ketogenic approach, but reversing other metabolic diseases. Because if you follow my approach, you will not have problem with cancer or any other metabolic disease too.
mhm.
It's like it's going to control the progression of your disease if you follow the approach that I'm writing in the book. Yeah.
Yep. Agreed. So this is really fascinating, the whole conversation. In fact, one of the things I was thinking about was this would be a good grand rounds for the Society of Metabolic Health Practitioners. Because again, so many people are struggling with this whole kidney question, so maybe that's something you can put on your to-do list to be part of that, and for anybody listening who's not part of the society, definitely check out the Society of Metabolic Health Practitioners website because it really, provides a lot of people, and I would say the same for, the Metabolic Multiplier with Cecile Seth. That site also provides a lot of people. You can search for providers. You can also learn from people who are thinking outside the box. And we need to grow that community and also support those who are part of that community. So I really, again, I think this would be a great Grand Rounds topic because it's kind of a hot topic. And for people who suffer from kidney disease, it's a scary topic. So I just want to put that out there. I do want to ask you just in terms of your own journey, when you think about how you're gonna keep yourself healthy over the next 12 months, are you gonna focus on nutrition, exercise, less stress, more sleep? I mean, what areas do you plan to focus on yourself to stay healthy?
One thing is after my journey, I start to learn more about ketogenic diet. I'm involved on all the things like genetics. I take at least 3 hours of genetics almost every week. Because we learn every day. And the functional nutrition programs, I found few things about polyphenols too. How to You don't have to go to high fat diet to be in ketosis, even
Mm,
if you manage or you drink or you take a lot of polyphenols. And I explained that in my websites. I have I have two. One of the major website that I have is Keto Dietitians Puerto Rico. Keto Dietitians Puerto Rico.
mhm,
By the way, I just last month, March was a month of nutrition and kidney disease, and
mhm,
I did a Facebook live like 2 weeks ago
mm,
about kidney disease, and the first thing that I say is don't expect that I'm gonna tell you if you go this don't need low sodium.
mhm.
That's not a mistake that people do. The salt that they're using
Right,
is a really high in minerals, or it's just a trash salt that you
right,
buy in the cup. Do you know what I mean? And I
yeah,
explain all of this in a book too, and in Keto Dietitians Puerto Rico, I create like a community, and
mhm,
I want to spread the world about this. We can do it. We can reverse kidney disease if you're willing, if you have hope. We can do it. And I create almost 3 years ago, two programs. I create a keto for Hispanic women, and I have another program that I create after I found out how we can treat polycystic kidney disease. Is keto for polycystic for kidney disease. I created that, and then again, all my patients that goes to my programs or just have one-on-one approach with me. Just be ready and show me everything that you have because I like to see everything. Even when I do the one-on-one, I go one-on-one, showing them about the labs, what
mm,
that means. It doesn't matter say that it's normal, it's
right,
not. Or I check the supplements. It doesn't matter that, I teach them because education is so important. And then again, I want to create more community. It doesn't matter where part of the world the patients are. We have to spread the world that this
yeah,
can works and you can prevent You don't have to be on dialysis. You don't have to be a transplant patient if you, you do the right way on time. Yeah.
And you have obviously you're bilingual.
Oh, yeah.
A lot of the material that you share is in Spanish, right?
I
So
create like the book is gonna be in English. And most of the I create. I'm in the process to finalize my program, full program about ketogenic for kidney disease. I hope that I will have it before I launch the book. I just released the book. It's going to be available. It doesn't matter if you cannot do one-on-one with me. That program is going to be available. And let me tell you, it's from A to Z, everything that you have to know about
mhm,
ketogenic diet and kidney disease.
excellent. Now, your book, where can people find it when it's
Well,
released?
it's you can sign in my website. You can just put your email, and then it's going to be released around like in June or the middle of June. We expect that it's going to be out. And then after that, we hope that it's going to be in Amazon. And then, yeah, it's going to be available for everyone around the world.
But we'll have links to your site. We'll have links to the Facebook group. We'll do all of that for people who are checking this out. Because again, if I was listening and I was at risk for kidney disease, I'd want to jump on board right away, learn as much as possible, have something to share with my clinician, and just move towards healing. But I will tell you, as what Teresa has shared, I have on, you know, Twitter, Facebook, I've shared success stories where the creatinine just plummets, the microalbumin plummets
Oh my
simply
God, yeah.
by making it's not even like if it's gonna happen. The only reason I don't see it happen is when people don't do the diet. I mean, it seems. Now there are some people who are further down, they're just about to be, asked to go on dialysis. There's a point when either they don't do it or it's too far down the road. But to think that you can't reverse kidney disease and to see what's going on with Dr. Unwin and his 143 patients or so in his study in the UK, we know this works. So if
Oh
you're
yeah.
looking for hope, that's why I brought Teresa to this episode to provide hope. I'm so happy she came. I'm so happy that we're now partners in crime. We like some of the same people. Cecile is one of my favorite people with the
Me
metabolic
too.
multiplier. She kind of embraces our community. So shout
Yes.
out to her if she hears this episode and continue the great work. And please check out her website. With that, any final thoughts before we wrap up?
Well, soon I'm writing the guidelines for PKD because not a lot of I believe that I was the first one working with keto for polycystic kidney disease. I'm almost done with that guidelines, and it's going to be available soon. It's not going to be like the book; it's going to be available maybe as an ebook. But it's general guidelines about PKD, what you expect as a practitioner, how the levels of, for example, vitamin D has to be greater than 50, details, how to treat PKD correctly. All of that is going to be available around June. Just sign in my website, and then you will get the information with, yeah, when it's released.
All right. Well, thank you again. And I appreciate you. I enjoyed this conversation. I was anticipating it. And let's keep doing this. Let's keep spreading this good message. Okay.
Thank you for the invitation, Dr. Hampton.
Anytime. And today, guys, we had a hopeful discussion, especially for those of you who have mild to moderate kidney damage or someone you may love who needs to hear this message. And yes, 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 you can reverse kidney disease with a ketogenic diet, particularly if it's mild to moderate. And if you're in that category of severe, with the right expertise guiding you, you can potentially consider it in that setting as well. So, if before this episode you didn't have hope, well, now you have hope. And today's guest, who I appreciate so much, Dr. David Unwin, and of course, my friend on Twitter, Go Live Sports, and Lucille Seth with the Metabolic Multiply. I want to thank all you guys for reminding the doctor that we need to talk about kidney disease and we need to talk about how the low carb or keto diet can help it. So I really encourage everybody watching this to check out Teresa's book. we'll have a link to her site so you can share your email. And of course, shortly after that, it'll be available on Amazon. I encourage you guys to check out the Metabolic Multiplier site, where you'll learn more about metabolic health that touches on this topic and others. And I, again, thank you so much for just taking some of your valuable time to learn a very valuable subject. Please share this episode, because there needs to be hope in all of those who suffer from kidney disease, and they don't have to depend on dialysis to
Yep.
live. They don't have to pray for a kidney to live. They may not even have to do any of those things if they learn these lessons. So again, I thank you again for checking out this episode. And until we meet again, be safe, be well, and continue to protect your nest. And thanks again, Teresa, for being here. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.